I was diagnosed with a toxic nodule approximately 4 years ago. I lucked out in the fact that I saw Dr. Ahmad from the very beginning. My family physician actually recommended him, and so I just feel like I got so lucky in the fact that I didn't even have to search this out.
Radiofrequency ablation is a unique treatment that targets benign thyroid nodules or overactive nodules and goiters. Traditional treatment of this condition was usually done with either surgery, radioactive iodine, or suppressive treatment with thyroid hormone, each having significant risk or complication.
I chose to go with RFA for a couple of reasons. One was just the fact of not having a scar on my neck for the rest of my life. I think anybody would choose no scar over scar. Another one was the pain. I think that with this procedure there was zero pain involved versus actually having your thyroid cut out. And then also the third and the biggest reason for me was actually the fact that you most likely will not have to be on medication. Your chances of needing lifelong medication after the RFA procedure is significantly less than with the surgery. And so that was, to me, a done deal once I've heard about that.
At the Thyroid Clinic, we researched and found that non-invasive treatments had been done for many years in Europe and South Korea with positive results and without the risk of complications that worried patients. We wanted to bring this treatment and technology to our patients. With over 12,000 operations between Dr. Jamal and Ahmed, we have the successful record of procedures on the neck. We invested several years in learning and following the procedures developed in South Korea, traveling there and working next to the pioneers in this field, since we found their techniques brought about the best results with minimal risk of side effects. We are the first to offer this treatment in Utah, but are certainly not alone, with such institutions as the Mayo Clinic publishing results on the successful procedure. We recently published our results of a case where we were first in North America to successfully use this technology to treat an autonomous and hyperactive thyroid nodule, and presented the findings at the American Association of Clinical Endocrinologists. RFA is similar to other procedures done in an office setting, delivering energy right to the nodule that is causing the problem, causing internal damage to the nodule by friction. We work with a patient's endocrinologist or ENT surgeon and thoroughly review their records to make sure there is low likelihood of the nodules being cancerous. They must be benign to use this procedure. The estimated risk of hypothyroidism after the radiofrequency ablation is less than 0.1%, and working with the patient's doctors, we assure they are getting proper follow-up after their procedure.
There was no pain whatsoever with the procedure. The only thing that I felt was really kind of like when the zapping was going on the nodule, I could feel kind of like a crinkling, kind of a sound of crinkling, and so I was coherent throughout the entire procedure. I could respond, I could feel everybody around me, but I was aware of everything that was happening to me during the procedure. Probably the drive home, it was tender. I would say there was tenderness, and I was, you could feel the spot where it had happened, but I never even took an aspirin. I never had any pain whatsoever with the procedure.
Our basic goal is to have at least a 50% reduction in the size of the nodule after treatment, and are happy to report we have exceeded that with all of our patients to date.
I would absolutely recommend this procedure 100%, especially over surgery. I think it was so simple, no side effects, nothing to deal with, no pain, no scarring. Absolutely 100%. I would choose this procedure any day over surgery.